All right. So, what is hypertension? I was asked, right? What defines hypertension? What is considered hypertension? I like the Joint National Committee's definition of hypertension, or the parameters for the hypertension is if you're below the age of 60, the goal is 140 over 90. If you're above the age of 60, then it's 150 over 90 baseline, and it's fine, right? The American College of Cardiology are a little bit more, I would say, stringent with their blood pressure regulations. The JNC 8, which is a Joint National Committee, say if your blood pressure is like 140 over 90, you're like 50 years old and you're thriving, you're doing well, your lab work looks great, then there's no concern, there's no emergency to treat it, unless it is greater than 140 over 90, right? However, if you're 140 over 90 and you're having certain consequences of the hypertension, like if it's beginning to affect your vision, if it's beginning to affect like your kidney function, if it's beginning to give you like the headaches, and you're having your neurologist like stroke like, so if your hypertensive is symptomatic, if your hypertension is symptomatic, then treat it, right? And like I said, whatever your primary care doctor tells you to take it. Therapeutic lifestyle changes are like a winner in any situation, right? Working out, eating better, stopping cigarette smoking, drinking little to no alcohol, less salt in your diet, 24 grams, 2400 grams is what's recommended. But if you can eat less salt, the better. If you can stay away from certain medications that are predisposing you to be diabetic, if you have a known autoimmune disease like lupus, make sure that you're taking your medications as prescribed, just to keep you from going into the red zone with the hypertension, right? So again, hypertension is silent. It's a silent killer. It has a lot of really bad side effects if it goes uncontrolled for so long. So just stay on top of it. And I wanted to end this video by just again citing some of the negative consequences of uncontrolled or untreated hypertension. It raises your risk for heart attack. It makes you more likely to develop heart failure. It causes kidney damage. There are more risk for developing vision problems. If it goes uncontrolled for so long, you can develop, for the males especially, sexual dysfunction, right? It raises your risk for peripheral artery disease that's in your legs. You start getting like poor circulation down there, putting you at risk for like stasis, ulcers, wounds that don't heal, all the things that happen with poor circulation in the feet, and also puts you at risk for having a hypertensive crisis, right? A hypertensive crisis is when your blood pressure is really elevated and is becoming very, very symptomatic, where you're having like a nosebleeds, there's the shortness of breath, there's the chest discomfort, dizziness, blurry vision. Take home message: ensure that you prevent hypertension if you can. Make sure that your hypertension is controlled. Take your medications as prescribed. And always across the spectrum, continue to do the therapeutic lifestyle changes, right? Exercise, eating better, no smoking, little to no alcohol, and do not take medications without the physician's supervision, right? All right, those are my 2 cents.